Hello, I am Dr. Arnold Bullock, and we are here to spend maybe 20 minutes discussing erectile dysfunction and the treatment options for men for whom the pills by mouth have proven ineffective. I am the Director of Men's Health at Washington University here in St. Louis, Missouri. I came to Washington University for my residency in general surgery and urology in 1987, after I completed my medical school training at the Johns Hopkins University in Baltimore, Maryland. My practice is now very specialized to include prostate cancer, male voiding disorder, erectile dysfunction, and I also do a lot of office vasectomies. So what we're going to speak about is erectile dysfunction, which used to be called impotence. It's just one of many male sexual disorders. And so it's very important for the treating physician like myself to first make sure that we're on the same page, to make sure that a man is not able to have good erections, he's just has loss of sex drive, or he has premature ejaculation. Some men come in and say they have impotence, and what they really mean is that they're infertile. So erectile dysfunction is defined as the consistent inability to achieve or sustain an erection for satisfactory sexual activity. So there are many men who are in their 40s, 50s, and above who can have an erection, who have very satisfying sex life, but they think that it's supposed to happen every single time. So 2 out of 10 times where, due to stress, tiredness, who knows, the erection's not working. On the other hand, the majority of men who have erectile dysfunction are sexually active. They just are dissatisfied with the rigidity of the penis or how much work it takes in order to obtain that erection. Unfortunately, most men who have erectile dysfunction never tell their physician. Only 1 in 5 men gets the courage to come in and tell a physician like myself, "Hey doc, you know, my erections aren't working too good. Is there anything that can be done about it?" And of course, there's things that can be done about erectile dysfunction. So it affects half of all men between the ages of 40 and 70. And as you can see here with the purple portion of it, you know, there's a fair number of men who have either mild ED, they can get an erection, they just think it's not as rigid as it should be, or moderate ED. They can get an erection, but it's not good enough to be maintained until completion of erectile, until completion of the sex act, or they feel that the rigidity is not enough for various sexual positions. So even though everyone has heard about Viagra, Viagra came out in 1998. It was so popular that my children couldn't take their Viagra ink pens or their Viagra watches to their middle school. Yet still, only 1 in 5 men routinely will tell a physician that they need Viagra. And so part of the problem is the undertreatment of erectile dysfunction. In order to be treated, you first need to come in and tell someone that you have this problem. There are a lot of myths surrounding erectile dysfunction. It used to be felt that 9 out of 10 men who had problems with erections, it was due to something psychogenic. That was even promoted by Masters and Johnson, who were here at Washington University years ago. We now know that 9 out of 10 men who have problems with erections is due to something physical. And that's why it's a major US medical problem for men. Because if a man has erectile dysfunction and comes in and meets with the physician and finds out why, then we could diagnose many men with diabetes. We can diagnose many men who have high cholesterol or dangerously high blood pressure. But the NIH consensus panel back in the early 1990s suggested that it affected 30 million US men. I like to say it affects 30 million US couples. And that 30 million is grossly underestimated if you ask me. It's suggested that 40 million or so US men have already tried the medical products such as Viagra. So it is not a consequence of aging, but certainly ED happens more commonly as people age. One of the main problems is a reluctance on the part of the patient and the doctor to discuss it. So why don't they discuss it? Because many men think that it's normal with aging, and it's not. it's normal for an 80-year-old man to still be sexually active. Felt that due to low testosterone, they just don't have a sex drive. In fact, the majority of men who have problems with erections have normal testosterone erections. Impotence is almost always psychologic. That's false. 9 out of 10 men who have problems with erections is due to something physical. Commonly, it's felt that men wake up in the mornings because they have a full bladder. And as men get older, they urinate once or twice at night and they say, oh, that's the reason why I don't wake up, because I don't have a full bladder. Your bladder has nothing to do with your erections. The erections occur at night because you go through REM stages of sleep as a younger man with good erections. And the last myth is once impotent, always impotent. That's certainly not true. We have multiple ways of improving erectile dysfunction, as we'll show. Again, most people have problems with their erections. 9 out of 10 is due to something physical. There is a component of men who have psychologic ED, but that's pretty well defined. They get erections in the morning. They get erections when they're by themselves. They get erection with one person, not another person. Well, that's psychogenic. So this is the anatomy of a penis. And as you can see, in the penis, there's these two corporal cavernosal bodies that are like sponges. And when a man gets aroused, blood flows into these spaces. It fills them up like a sponge, and it compresses the veins closed so that the blood gets in, can't leave out. And that's how an erection is generated. And so you need a normal neurologic system. You need normal hormone levels. You need an intact spine and spinal cord. You need blood vessels that are of good patency, not blood vessels that are filled with a lot of atherosclerosis or sludge. And you need a heart that has enough cardiac output in order to fill up the system. So multiple other medical problems are associated with problems with erections. Half of all men who have high blood pressure have erectile dysfunction, regardless of age. If you have severe heart disease, chances are you have erectile dysfunction. 2/3 of men who have diabetes have problems with erections, and 9 out of 10 men with severe depression have erectile dysfunction. Of course, men who have depression are most easily treated with the medications. So the reason why ED is such a big deal is because if you have ED, odds are you have some other medical problem, whether or not you know it or not. And so men have problems with their erections long before they have a heart attack or a stroke. And this is the reason why. The blood vessels in your heart are much bigger than the blood vessels in your penis. So the atherosclerosis, the plaques in your arteries, will show as erectile dysfunction about 2-3 years prior to you having a heart attack or a stroke. So you wish men would come in and find out about their erections and find out about other medical problems in order to correct those problems before you end up with a major cardiac event. So ED is associated with all of these other things: alcohol, sleep disruption, low testosterone. If you have a heart disease or hypertension, you have twice the rate of having problems with your erections. If you have a sedentary lifestyle, you don't exercise, you just become a couch potato, you double or triple your chances of developing erectile dysfunction. And if you smoke, you double your chances of losing your erections. So when men or people suggest that I'm treating men 70, 80 years old for problems with erections and say, that's not reasonable. You know, why would you worry about in someone that age? Well, that's like taking the driver's license away from a person 80 or 90 if they're mentally sharp and still enjoy getting out and they're safe at doing it. Same thing. Whose right is it to say that a person at whatever age shouldn't enjoy something that they've enjoyed for their lives? Especially since there's so many treatment options that are safe for people to consider. So if a person drinks a lot or smokes a lot or, you know, could possibly improve their mild erectile dysfunction just through lifestyle changes, that makes sense. We measure people's testosterone levels. Giving testosterone in conjunction with an oral agent may work. But aside from trying the pills first, there is no real way of saying that you have to try first line, then second line, then third line. Because there are a lot of people who just admit, Doc, I'm not going to stick my penis with a needle. I want the best therapy that you have. but it's important to at least talk about it. You know, people have heard of these drugs, Viagra, Cialis especially, and they're very, very safe. They're safe except for some people who have different types of heart disease. They have very few side effects. Yes, 1 in 6 will say they get a headache, but if you take Tylenol or Motrin ahead of time, you can alleviate the headache. Some people who are fair-skinned will say that because this blood increases blood flow throughout your body, it can cause headaches, it can cause facial flushing. It does not cause blindness. It may cause in 1 out of 30 people. So 30 out of 100 people will, 3 out of 100 will say when they take this drug, they have a problem differentiating blue from green. It's not like you go blind. So that's a myth. It's not like it creates heart attacks or strokes. If Viagra causes blindness, heart attacks, and strokes, wouldn't we see these commercials on TV? Let's say, you know, call this attorney, you know, Rupert and Rupert, you know, if you've taken Viagra and your loved one taken Viagra and had a heart attack. So these drugs don't cause heart attacks or strokes. They're very effective. So for a person who has mild erectile dysfunction, you can expect that it will work. But if you haven't had an erection in 4 years, or you have severe diabetes, or if you've had pelvic level surgery, there's only a 4 out of 10 chance that it will work. So Viagra, this is a part of the package insert. And it says compared to a sugar pill, Viagra is nearly 80% effective. And so, yes, it does work. So some people say the Viagra doesn't work right. And that's because they took it with a full meal. It works better on an empty stomach. They didn't give it an hour to get into their system. They thought it would work on its own. It only works if you get stimulation. And it may not work on the first or second try. You cannot give these pills to your friend, because if someone is taking a nitrate and you take a drug, one of the erectile dysfunction pills, along with a particular type of heart medication that includes a nitrate, that drug combination could be very, very detrimental. Most people have never heard of this option. It's called MUSE. MUSE is a little pellet. And you slide this pellet into your urethra, into your urinary tube. And then you rub your penis for 30 seconds to help it to dissolve. And you stand up for 15 to 20 minutes and hope you get an erection. It was used back in 1997, but the drug has a very, very low response rate in men who have failed Viagra or Cialis. And that's the reason why most people haven't used MUSE. In fact, I haven't written for it in many years. There's a vacuum device. Vacuum devices work. They're simple. You put this little pump over your penis. You operate this suction device, and it sucks. It creates a vacuum and sucks blood into your penis. And the way that the blood is maintained in there is by this little ring. This ring is like a tourniquet. And as long as that tourniquet is on your penis, you'll keep the erection. Now, this erection looks pretty rigid, pretty full. But one of the complaints is that ring is uncomfortable and the erection is not quite as rigid as most people would prefer. The real drawback is you got to break the sort of mood in order to see if this is going to work. And obviously, this picture doesn't apply because there's no ring at the base of the man's penis. So it works. It's inexpensive. But the biggest problem is lack of spontaneity and the rigidity of the penis. But it's only a couple $100. And so why not try it? Many men have heard of injection therapy. You hear it from commercials on TV, penile injection therapy. This is something that people have used. You stick a needle, same size as the diabetic uses, into the corporal bodies, and 15 to 20 minutes later, you see if you get an erection. It seems so painful, but again, it's the same needle that you would inject in a diabetic. It works. Lack of spontaneity and the discomfort of it creates a very, very high dropout rate. And then the last option, which shouldn't be considered last, most people consider an implant or should consider an implant if the pills don't work, and that is a penile implant. I really like to say a penile implant reminds me of a Mercedes-Benz, because I have an old 2003 Mercedes-Benz, and it still runs today. If I need to put some sand in the back of my car, I'm gonna put it in the back of the Benz. It's old, it doesn't look pretty, but maybe it's been in the shop 3 times in the past 17 years. I still could drive it over 100 in a heartbeat. And I know I could drive it into Chicago, and I haven't even started a car in the last month or two. And so it is just a very reliable, high standard. It works for a range of drivers, people who race the car and people who just want something that's safe. And so even though I present all the treatment options, the penile prosthesis is clearly the option that provides the best satisfaction. It's prompt, it's spontaneous, it feels normal to the partner, you have normal sensation to the man, it's covered by most insurance plans, and it's not visible. There's really 3 types of implants. Let's go through them. There's a malleable implant. A malleable implant is for a person who has poor hand dexterity. And so it's like a Gumby bear. Wherever you bend it is where it stays. So when you want to use it, you bend it up. And when you don't want to use it, you tuck it down. Maybe 2% of men get a malleable. There's a 2-piece implant. It looks like a malleable, but it has a pump in the scrotum. And so when you want to work it, you can just merely pump the device and it creates the erection. And then this is the top of the line. This is called a 3-piece inflatable penile prosthesis. It has a pump in the scrotum, has a cylinder in the penis, like little inner tubes, and has a reservoir that fits behind your pubic bone. And so you can't see any of this. It's put in through a 1.5-inch incision. I'd usually make the incision on top of the penis in the hairline. So 2 months after it's put in, I tell people, look at yourself in the mirror and tell me if you can see it yourself, let alone somebody else seeing it. And when you operate this pump, it basically sends fluid into the cylinders and it creates the erection. So the implant's like an inner tube in a new car. If some kid puts a needle in one of your 4 tires in a new car, you put an inner tube in it, I suggest you can't tell which tire has the inner tube in it. You can't tell the difference. You can run it as fast as you want, and you expect that tire to stay inflated until you deflate it. And so I put the whole thing in through 1 inch. It takes about an hour to do the surgery. You stay overnight, 1 night. You're sore for about 7-10 days, and you return to full sexual activity in 5 to 6 weeks. What's the advantage? It works every time you want to use it. It creates an erection as strong as you can generate the pressure in your fingertips. So maybe an older man doesn't have the same strength of a 30-year-old. So the erection in a 30-year-old could be stronger than the erection in a much older man, but yet still they're both good enough to work. Over time, just like a Mercedes-Benz, it will fail. Will it fail in 6 years? That's possible, but most of them will last 10 years. Some of them last 15 years. It's not new. Implants came out around 1971. And so the latest innovations have, but just like a car, they keep making it a little bit better, a little bit better. Like that Buick commercial says, it's not your father's Buick, so it doesn't stay the same. They keep making newer innovations. I like the MS. The MS has a coating on it that makes it feel much softer, feels like a normal erection. Some people say, hey, doc, you made me short. So with the new 700 LGX, as you pump the device, it will try to keep expanding your penis to wherever size you were meant to be. So it can expand up to 20%. And it feels soft because it has multiple layers. So the feeling of the implant, just when you examine a man's penis, feels pretty normal. But then there are some people where the expectations are lost. It will not create an immediate erection. You have to pump it up. It will not make you longer than you want it to be. It's not like a breast implant where someone can come in and say, hey, I want my penis to be this long. No, it's like you can't make your foot longer than what it is. It is what it is. Well, what if we made it longer than what it is to stretch it? It would be like putting your shoe in a shoe that's too small. Putting your foot in a shoe that's the wrong size. Sooner or later, your toes will start to hurt. So the risk of an implant is an infection. My infection rate, like the other top 20 or 30 in the country, is only 1%. And if it gets infected, we can fix it, we can treat it, we can put another one in. The reason why we don't make it longer, if you put cylinders in a penis that's longer than what the penis is meant to be, over time it's going to try to pop its way out. Very, very high satisfaction rate, 98% satisfaction rate. Like 94% of implants are still in place, working without revision at 7 years after the implant's put in. So insurance covers it. Most people are surprised with that fact. But if a person has Medicare in the secondary, or let's say HMO plan, the average man only pays $300 out of pocket. So that includes surgery, hospital, the whole anesthesia, the whole shebang. My insurance, my office does all of the insurance work for you. So typically we will do this as an in-person conference, but obviously, you know, we're in COVID area now. But putting it all together, erectile dysfunction affects a large number of men. Only a minor percentage of the men, small percentage, ever get the courage to come in and talk to an ED specialist like myself. And it takes them 2.5 years to build up that courage. I'm suggesting that you can call my office. You can come in, be seen, we'll review these options with you. If you want to try the injectable, we'll do it on the first visit. But another reason to come in is not just for your enjoyment. It is because if you have ED, chances are you have some other major medical problem that's associated that's putting you at risk, and you need to come in and be seen. So why should I be your surgeon? Because I'm one of less than 100 surgeons who places more than 24 implants a year. In fact, they usually say I'm in the top 20 in the country. My infection rate's pretty low, and it's a major part of my practice. And so, you know, it's something that I specialize in. It's something that I'm recognized for doing the more complicated procedures or fixing other implant problems by other urologists. And I've been doing this for now over 30 years. So if you need help, call my office. The number is 314-362-8200. Thank you for participating.